Julie Hinman, welcome to the show. I'm excited to have you on. You've been back and forth about this for a little bit, so I'm really excited to talk about what you're doing. So before we get kind of started on really the big thing that I really want to talk about, that I'm super excited about, you've had such a huge impact in your state. But let's just talk about you as a clinician and just how did you make the journey from, just conventional training to where you are now with really such a huge focus on root cause medicine? Just tell us a little bit about yourself, your practice, your journey. I know there's a story. You didn't just probably come out of the gate with this desire to help people at that level.
Yeah, Dr. Terri, well, thank you so much for having me. I'm really excited to be here and share a little bit about myself. I've been a nurse practitioner for the last 10 years, and I started out as a nursing assistant in 2000. So I spent about 25 years in the medical community, and I've gained a lot of insights. Most of my career was spent in underserved populations. So my last job that I had at the hospital was working in the emergency department at a critical access facility. And that gave me a lot, this history with underserved populations. You kind of see the most unhealthy people and a lot of preventable illness. And so I would work there. We deliver great care. We save a lot of lives. There was so much learning, and really achieved what I thought was the pinnacle of my career. But when I got there, I felt really unfulfilled, that I wasn't doing enough, that my calling was for prevention and more of at a greater and higher level. And so on my own, personally, I was doing a lot for my health. I was really focused on my nutrition. I loved anything to fitness and wellness related. And so I lived these what felt like two polar opposite lives. And while you have every desire to share what you know with people in those quick, 3 to 5 minute visits in the emergency department, it really is, for lack of the term that we use is treat them and street them. If they don't need to be in the hospital, we need to get them out because they're likely going to get more sick. So,
right,
caused me to have to evaluate where I was going to spend the latter part of my career, the next 20 years as I worked towards my retirement. And during 2020, as many people did, I got kind of to the breaking point, and I decided that I was going to pursue functional medicine full-time in a full-time practice, and that there had to be more people out there like myself and you who are practicing a root cause and really helping people to understand what they need to do for their health and what control they have over their progression of their disease or prevention of their disease at the primary. So I'm really passionate. I love what I do, and I'm excited to be here and talk to you about that today.
Yeah, it's awesome. It's so funny. I've interviewed clinicians across the specialty spectrum, medical doctors, nurse practitioners, naturopathic doctors, chiropractors, and the common thread of, the common theme, I should say, of everybody that comes on the show that is in more of a functional integrative space is exactly the story that you just laid out, is just becoming disenchanted with our current really sick care system and this kind of allopathic model of just treating symptoms, band-aiding symptoms, with a medication, not really digging into the root cause. And I think more and more clinicians are moving in this direction, because I think if we're being honest, we're seeing that what we're doing hasn't been working. We are at the bottom of the list of the healthy countries. We're almost last on the list, and yet we have the most access. We're the wealthiest countries, but we're sicker and sicker every year. And then, of course, it's trending into our pediatric population and the kids, which is just heartbreaking, because when I started this journey as a clinician almost 30 years ago, type 2 diabetes used to be called adult onset diabetes. And now the adult is out of it, because, something like 1 in 7 or 8 kids is now diagnosed with, insulin resistance, really. And so that's kind of become a big focus and passion for you, besides what you're doing just with your patients in general. You've got some work going on with getting to some of the root cause, which is, what are we feeding our kids? So let's talk about that and talk about a little bit about what got you passionate about this to do this work at your state level with working on this bill, and to just walk us through that, because I think it's so important, and so many states could really model some of the things that you guys are doing there.
Yeah, it's been a really exciting time. So I'll say there's nothing more intense than a mother and her willingness to protect her children. And I would say I've really always been interested in pediatric health outcomes because I've seen them decline throughout my career. So that's always been an interest of mine. But as a mom, I would say that things really changed when I began to see what was happening at the schools and what our children were being, what they were taking home for lunch. And during COVID, because of the programs, my son had come home with a brown bag lunch. And it's wonderful, right? The intent is positive there. We want to send kids and make sure they have, food for, in many cases, kids are eating breakfast and lunch at school and they're only having one meal at home.
Right.
And so what he brought home was 2 Uncrustable sandwiches. And I just was really shocked. Number one is probably a serving. Number 2, each one had about 20 or more grams of sugar per serving. So you're like doubled the amount these kids should be eating in one day, let alone this doesn't even begin to touch on the ingredients that are in these foods. And so as a mom, I thought, well, I know because I have, all of these years of experience, this, interest in nutrition, this passion for wellness behind me, plus this medical career. But what about the moms who don't know? What about the moms who really don't understand? They're sending their kids with every intention, thinking they're getting a healthy lunch because why wouldn't they be getting a healthy lunch? And so that created frustration on my part. And a lot of my frustration was kind of shared around the kitchen table with my husband. And we're lucky that we have, would say, kind of a dynamic partnership between the two of us. He is a lobbyist. And so some things were happening, in the country around health and wellness conversations. And so the policy here in Arizona was really written around how can we address this as parents primarily, because we're worried about the health of our kids and our, the public, and address this at a greater level. And so at that time, Representative Leo Biasucci was very interested as well in this issue in health. And so that's where the bill was born out of. And I would say that it has really paved the way for many other states to maybe use this language to model their language as well.
Well, I'm sure like anything else that it's not that easy. And so I'm sure you faced a lot of challenges. And the main reason I kind of want to touch on some of the challenges that you faced and how you pushed forward in this is because I think so many of us aren't vocal at the local, even just starting at your school board level, really and truly. But the local state level is because we're intimidated by it. We don't know, I don't know anything about politics. I shouldn't be involved. But that's just not so, because it actually is this grassroots. And to your point, you do have a dynamic relationship with your husband to be able to kind of help steer those conversations and understand that. But I'm sure you faced some challenges, and what were those and what kept you moving forward?
So we had a lot of help at the Capitol, and Senator Janae Shamp is a registered nurse, and I would say her health, she's been a registered nurse for decades as well, has had, a long history serving in her community all throughout COVID, and has now found herself at the legislature, and which is wonderful to have her backing and her knowledge and experience of these problems as well. And so I would say that the challenges, this bill was received really well on both sides of the political aisle. And I think that there's a number of reasons for that. Number one, we're experiencing more chronic illness, right, as a population. So if you're not experiencing something chronically, someone that you know that
everybody,
yes,
no matter what,
have questions or is not getting better or has had this experience in healthcare where they're not finding solutions. And so there's a sensitivity for kids. So we start talking about pediatric, kid nutrition and children, and the questionable ingredients that our children are being exposed to at school.
Right.
No one really wants to be on the other side of saying, I think I want to leave all questionable ingredients there. So thankfully, it really was, it was a positive it was a positive experience in a way that I'm not sure all legislation is.
So this school lunch bill passed unanimously, like you said, in both the House and the Senate. It was signed into law by the governor, which is a huge achievement. What can you just walk us through the process of getting that passed? I know I love what you're saying about, who's going to argue with continuing to, poison our children, essentially? Like, nobody's going to get on the wrong side of that for sure. And then what do you think some of the key factors were in the success of it? You already mentioned a few.
Yeah. So when we were modeling the language in the legislation, we were looking for ingredients that were banned in other countries, or certainly California has some bans on ingredients. So we were looking for the ingredients that maybe hadn't been shown, but that had been shown to either have questions about their safety or had maybe shown some concerns in studies like mice studies. The red dyes are a really good example of that. Yes. They have been shown to be carcinogenic, and red number 3, I believe, was just removed by the FDA in January. It was Finally. And so that's where the original list of these ingredients came from, is just looking across the board. What's a good starting point? Because really this bill is just the tip of the iceberg when we first wrote ingredients and where we're headed. And so, that's kind of where we started. And
well, what is the end result? Like, what is the lunch bill doing? Like, what is it saying you can and can't do? Like, break us down exactly what it is.
Yeah, so some of the history of like what the process was, what we went through in order to get it. So we developed the language around the bill, and then there was a press conference. So that initial press conference was really critical to getting the word out there, gaining the interest of the public. We had some really critical individuals who stepped up to the plate here locally in Arizona. We had names like Danica Patrick. She came out to that original press conference. Rob Schneider, which, as a comedian, he has a huge voice nationally. That gained a lot of attention. Callie Means was also here locally and was down at the Capitol and had an opportunity to speak that morning in front of the Senate and have a discussion about these ingredients and just what's happening. So that really gained a lot of momentum.
So at the end of the day, the bill is basically prohibiting foods with certain ingredients that have been shown to be health disruptors on a lot of levels, probably inflammation core. I'm assuming that's what the end result of the bill was.
Yeah. So it removed these 11 key ingredients from from any prepackaged food. And that's really important because it's not just the food, it's the ingredients, but also the processing nature of these foods. And so launching into next year, of course, there's an implementation phase where these foods will have to be, removed from our circulation inside of the schools.
That's awesome. And you actually also got to participate in a round session with Secretary Kennedy and some lawmakers. What were some of the key discussions and takeaways from that conversation? And was this before? Because I know you did things at the state level, but now you're moving into the national level of having these conversations and getting at the table with some of these key decision makers and stakeholders. So talk about that a little bit.
Yeah, this is a really exciting time, both, as a mother who really is passionate about this issue, but also as a clinician, to be having these conversations with key leaders and influencers, both at the state level, but also at the national level. There's such an impact that we've had locally that we hope will really, translate to more changes in nutrition, and whether it's at the schools or at, the packaging and, level, it would just be wonderful to see some changes. And so Secretary Kennedy did visit Arizona, and it was a tremendous opportunity to not only have a conversation with him and be at this table of 7, having the conversation about pediatric health and school lunches and nutrition. And, and from there, we ended up having a press conference. So the press conference to really share what the goals were around this bill and what our hopes were.
That is so awesome. I can't tell you how, I know you know how important it is, but man, what an amazing just opportunity to really impact such a big problem in our country. I think about a story of, and I know these stories are just a dime a dozen, really and truly, but a patient of mine, her 3-year-old was, they considered him a hyperactive kid. He was all over the place, running, jumping, like he was your classic, beyond a normal 3-year-old running around. He was just kind of out of control. And of course, conventional medicine wanted to put him on medications at 3 years old, like Ritalin. It's just heartbreaking. And she just didn't feel right in her gut about that and just started doing a lot of research. And she started stumbling upon a lot of the information that's been coming out around food dyes and the conversation that we're talking about. And she just made a decision to, in her household, just cut out anything with food dyes. She's like, you know what? It's worth a try. Like, what if this could be the problem? And within a week of changing, that kid is a different kid. And she was really concerned about it because she had another baby and she was afraid his excitability something was going to happen, like he was going to accidentally hurt the baby or something. And unbelievable night and day difference. This kid could never just sit down and play with toys or thumb through a book. He was just all over the place. And now just completely calm, completely changed everything. And just something that simple as removing food, anything with food dyes, which is essentially processed food in general. Let's just, kind of start there. So I think it's so important to bring more awareness about how many diseases, how many conditions we're treating with medications, especially in our children, depression, ADD, hyperactivity, all those things that really probably do have an origin in the foods that we're eating. So such a profound thing that you're doing. It's amazing.
It's incredible to think of the impact, and a primary impact. It costs nothing and will impact his health in so many ways, right? Your ability to focus and learn during school, the teachers, and the impact this has on our school system as well. There is just a ripple, right, of consequence of not treating these things when the intervention is just so basic. It's just primary. So yes, wonderful.
Well, it's going to be it's going to be a paradigm shift to, I've talked about this a lot with different guests on the show about food. And, I was back when my older daughters were in, junior high school, and were athletes and swimmers. And, you was a victim to the marketing of, the Costco pantry and all of the quick, snack bars and nutrition. You get so fooled by marketing as a parent, so I'm always kind of trying to make the point is, please don't, as moms, we'll have a lot of shame once we learn about something. We're like, oh my gosh, I did all these bad things. Oh my gosh, I'm a terrible mom. No, we are being marketed to constantly. Our kids are being marketed to. And the truth of the matter is, a lot of these foods and a lot of these ingredients are highly addictive. So it's kind of hard to, especially sugar, it's really hard to get initially these kids off of these foods. But I think the first thing is bringing awareness, because to your point, I don't know a single mom that is going to choose to continue to give their child something that they know now, like once you know it, you can't unknow it, cause harm. I just don't believe that's the case. So
I agree. And, you're right. The conversation, if you have no idea, why would you think that anything on the shelf would be less than safe? Sure. And that's the bigger conversation, which I really am thrilled that we're having. So for so long, I think we go to the store and think, why wouldn't this, box of cereal be safe for our kids? I mean, it says, Dr. Terri, it says heart health right on the front. It's right. Healthy.
Gluten-free.
Yes.
It's gluten-free Frosted Flakes.
And unless you live in this industry, right? Unless you have, how else would you be able to navigate and really understand? So you're right. We have to support moms in making the right decision. And it's just about information. It's just about their knowledge. And when they see the changes, like you mentioned, this mother has had in her kids, it's undeniable, and it allows you to continue, kind of making those decisions and advocating for those little wins.
Absolutely. And, and these, gosh, this is such a big elephant that it's so overwhelming. In fact, you kind of start to think about, you've got Secretary Kennedy's department, and then you've got the ag department, and there's all these different, the dairy, I mean, there's all these different industries that play a role in this. And there's a lot of stakeholders from, businesses, the farmers, it's such a huge elephant. But again, I think that your approach with educating the lawmakers, and because they don't know, and mostly educating, moms at the level that, this is kind of going to be, and it already is kind of a grassroots effort. But look at, what do you see for the future really of school nutrition nationwide, like building on what you guys started in your state? And, what do you see for the future of that? What are you hoping for?
Yeah, I really hope that this bill is just, again, the tip of the iceberg when it comes to the conversations around, what's happening in schools, but also in our own pantries and our homes when it comes to nutrition, right? Our nutrition, because of the health of our young people is depending upon us making a better decision and making some changes. We can't even financially keep up with the health crisis as it is right now as a country. And so something has to give. And, again, I think that implementing this, we're already seeing that Representative Biasucci has implemented this in some schools in his own hometown. And so we're hoping this is able to translate to other schools and kind of set the blueprint. And again, the blueprint for other schools to then implement these things. Start to bring some of the kitchen back, right? The kitchens that have been removed from schools to cook food. It doesn't continue.
Home economics.
I've learned a ton in home economics. Yes. So that would be great. But I think the conversation, the fact that we're asking questions, that we have some big voices, we have some noisy voices right now that are kind of, we can't not hear them. Thank goodness for, the book like Good Energy by Casey and Callie Means. They have just done.
Everybody should get it.
Yes. I mean, we're just seeing that. And as clinicians, those of us who are functional medicine trained and have that heart for nutrition and for wellness and for the foundations, I think that it's a really critical time to help support people in moving away from this medicated mindset and, into a different intervention, because we all need it, quite honestly.
That's right. We call it the pharma hamster wheel, and we're getting children on that hamster wheel younger and younger. It starts really with, baby formula. We could go there. I don't really want to go there, but it starts really in the womb, truthfully, and really educating moms that are of childbearing age, how to prepare your body, how to, now we're seeing with epigenetics, a lot of these metabolic disruptions are happening in the womb, and you have babies born with already they're behind the curve with healthy, just metabolic health out of the gate, from stress to what the mom is eating and so forth and so on. And that trickles over. It's such a huge conversation. So one of the things that, kind of pops in my head, and I'm sure you guys are going to do this, but it would be interesting and, to see once this is being pushed out in certain districts in your state, collecting data on the health of those kids. And that's really where the gold's going to be. So are you guys doing anything in that area?
I'm so glad you asked. So as a
smile just got really big, I know.
As a researcher and as a nurse and nurse practitioner, we have to be able to prove what we're doing has impact. That's right. We also have to be able to prove that it is worth the investment that we're making. And so you're right. I had early on when all this was passing, I whispered to Senator Champ, who's the registered nurse, and I said to her, what are we going to do to track this data? And, how are we going to... Yes, because you're right. We have to show that it's had an impact. And I think that there's lots of ways that we could be examining the data. It could be classroom incidents, right? There's so many there. It could be even if at the self-reporting level, if we have potentially higher test scores, if we have self-reported teacher scores or, childhood behavior, there are so many ways to examine the data to show impact. Obviously, we need to create that study and make sure that it was sound. However, there is just such an opportunity there to really show what type of impact we're looking to have.
No kidding. Well, a thing that just popped in my mind for you, and this could be even everywhere, but in your state even, is tap into DMP students that are looking for a project for their, for their capstone project, or, for whatever they're doing, because this is a huge area that, for 2 years, we've got to collect data, and we have to, really write a research paper, really, or some sort of intervention or QI project or something. And this would be such a huge one for PhD students, DMP students. If anybody's listening that's a DMP or PhD and you need a project, I think looking you up, this will be a huge one.
Yes, absolutely. I would love to have some support. It's funny when you finish those research, in many ways, you think, my goodness, what will this lead to? But, thank goodness for our research background that we have as doctorally prepared nurse practitioners, because it really puts us in a key position to be able to help evaluate the metrics and the measures and the impact that we're having locally in the community.
So for other parents and communities that are listening, how can people get involved in advocating for better school food in their own areas? What advice would you give? And, for people that just go, you know what, I really want to get involved. We need to make some changes. Where do they start?
Yeah, I think that we were at an event recently, and there was an educator in the group, and she had a long career. And she said the best way to get started with this is to start talking with your principal, start asking questions about where they're at, start trying to be available, to help implement these changes, because the parents want to see these changes. And there's always parent-teacher associations and organizations where you can help to be involved in the kitchens. And, maybe it's showing the changes that are happening. Maybe it's implementing some type of even cooking class. Maybe that's not related to the policy, but it helps create awareness right around the conversations that we're having about food. And so talk with your principals, talk with your educators, talk with other parents so that they know what's happening. So the more of us who are invested and who are speaking up, who are advocating for the health of our children, the better.
So in your state, do you kind of now have, or I'm sure you're trying to create even a blueprint for success in this area that maybe other states can pick up and adopt and not necessarily reinvent the wheel? I know it's early and we haven't really kind of, there can be nothing wrong with getting these 11 ingredients and foods out of our kids' systems. But what do you guys have going on that you could offer as tools to help people in other communities, other states that aren't really doing much of this yet? Do you have anything prepared that way, or is it too early for that?
I think it's too early for that. I think that right now they're implementing the program locally in a small community. And so, but as this comes out and as there's more action, I mean, certainly the goal would be to have a program or, something that was scalable. The legislation itself is a good template for other states who maybe did not adopt this. Something similar last year is a great place for people to get started with a similar piece of legislation so they can start to take some action in the following legislative year.
Any conversation at the national level? I don't know if this came up in some of your roundtable discussions with Secretary Kennedy and that group, but any conversation about states and school districts that receive federal funding and backing that up or offering incentives for districts that maybe adopt some of these things? Or is it again, too early? We're so early in the conversation.
Yeah, I think it's too early in the conversation. But I do think that the larger conversation around health and around nutrition and around ingredients that are in our foods is being had. And so how exactly that impacts federal funding for schools, it'll be interesting to see if there's some changes.
Yeah, some incentive there. That's so awesome. Well, what anything else you want to say about this and the just what we're talking about with school lunches and starting with our kids? Like if there was one thing you wanted to make sure the moms out there kind of catch from this conversation that we've had in the last 30 minutes, what would that be? What do you want to make sure that sticks with people that are listening to this episode?
Good question. What I'd love for every mom to know, Well, number one, your heart is there with, how you care for your kids, and bringing home is the primary, meeting our need for food and nutrition every day is a primary. And so it's a wonderful gift that you give your kids. And I want to commend you for just paying attention and listening to the conversation. There are apps like the Yuka app, YUKA, that you can download that can help you really understand what's in these packaged foods. Maybe you can't read all of the ingredients, and that's a good place to start with our prepackaged foods, but understanding, starting to begin to look at labels. And that app is tremendous and wonderful. And then the second thing is the ingredients. The sugar is really driving a lot of our chronic disease. So if I could tell you another thing, one tool that I learned early on in one of my nutrition classes, I had a new dietitian that was teaching a class, and she said, you want to try to avoid anything that has per serving more than 12 grams of sugar. That's really hard to do. And if you're looking for sugar per serving, added sugar, and you're looking at those ingredients, the processed and added ingredients, you already are outdoing the majority of people, because we just, things have been snuck into our food and we have no idea. And I think the other piece of that is there are times where you just get in your routine, right? Go to Costco or you go to the grocery store, you buy the same things. So often the products or companies may be purchased, they may be altered, and next thing you know, you turn around and you say, I had no idea this ingredient was in there. And when did this happen? So the other piece is you have to be, unfortunately, you always have to be on the lookout and be continually reading labels and keeping up on this stuff. And you don't have to be a scientist or a clinician, just paying attention to what you're bringing in your home. And if you're noticing behaviors in your kids, or they have unexplained illnesses, skin rashes, inattention, they're being diagnosed with, and pediatric arthritis is a good example of this. Like, we're seeing more and more of these autoimmune disorders. What drives the immune system? And something that we can't out-medicate is our nutrition.
Right. That's right.
So as a primary, and starting there that's a great start.
Well, and it's so easy, my advice always is like, well, let's start with just not making a package, something you open out of a package, part of your daily routine. That might not be realistic for a lot of people, but I think there are options where we could kind of shift out of that. I have a new nurse practitioner that's working with us that came from the allergy world, and same story as you just started with. She just was, we are not helping anybody. We are not helping our patients. It is not normal to have peanut allergies. There was no such thing as a peanut table when I was in elementary school. So when you see all of these disease process, all these allergies, pediatric, arthritis and eczema and psoriasis and anxiety and all these things in these kids, it all goes back to the gut. And the gut starts with what we're putting in it, right? And so, her conversation was the same as just, we're just band-aiding things and putting people on immunomodulators and not even getting to the root cause. And I think that's just, you said something so important that I don't want people to miss. We have normalized peanut allergies, avocado allergies, banana allergies, eczema in kids. We have normalized all of this, and it is not normal. We did not have these. If we had them, they were very rare decades ago. And this is something we got to pay attention to. This isn't normal. So I love that you bring that intuitive. Women in general are intuitive. We're intuitive as mothers. Follow your intuition, follow your gut, and start with what you said. Just really get educated on reading labels, really get educated on understanding what is in things, and especially the added sugars. Sugar is the most addictive inflammatory molecule we consume in our body at large quantities, in the largest quantities. So that advice is so great. Well, I appreciate your time. I want to talk to you a little bit more offline, because I think there's a lot of things that we can kind of do together to push this conversation forward. Starting with things like this is really important, but I really appreciate your time and everything that you're doing. I mean, this was no easy lift, even though you said it was kind of easy, but I know that it wasn't easy, what you did in Arizona. And I really appreciate everything you've done there. And this is legacy work. What you guys have laid as a foundation the ripple effect that this will have nationally is something to be acknowledged. So thank you.
Dr. Terri, I appreciate it. And I appreciate all that you do for the community and for pushing for just being a voice for functional medicine. You're right. When I left the hospital, I was so dismayed. And to be here and to be having such an impact on the community and with my patients and the functional medicine world is just a tremendous gift, a tremendous gift.
Amazing. Amazing. All right. Well, thanks for being on, and we'll keep the conversations rolling.